Welcome to this fun Q&A about your cycles. So I'm going to go through questions that you guys asked. If you have questions that you would like to be a part of a Q&A, go ahead and comment them under this video, and if there's enough questions, I will go ahead and make a second video. But yeah, without further ado, let's just jump right into it. So the first questions that I'm going to be going over are related to kind of getting a diagnosis, PCOS, endometriosis, all that kind of stuff. The first question is how to get an endometriosis diagnosis and find a doctor that will listen. Kind of a two-part question, and there were multiple people who asked about getting a diagnosis for endometriosis specifically, and just like multiple people asking, like, how do I find a doctor that's actually going to take me seriously, listen to me with all of these, symptoms. Let's first talk about finding a doctor who will listen to you. This is really, really important, and if your doctor is not taking your symptoms seriously, it's okay to look around for someone new if you are able to. My biggest piece of advice when you're trying to find someone to help you to diagnose something with your cycle. Sorry if you hear dogs in the background. I'm dog sitting right now, so you might hear the little pitter patter. Find an OBGYN that is a NAPRO OBGYN. So it might sound weird, but it is short for natural procreation technology. And that sounds really fancy, but it's really saying this is a doctor, this is an OBGYN who is looking at your body's signs. So all of the symptoms that you come to them with, they will take seriously. If you chart your cycle, which is something that I teach on this platform and on one-on-one sessions, if you chart your cycle like cervical fluid, your periods, ovulation, all of that kind of stuff, they will really heavily rely on that information to figure out what kind of blood tests that you might need done and to uncover things. So they're really more of a holistic, natural approach, and really listening to your body is a big hallmarker of that, NAPRO. So NAPRO, if you Google NAPRO OBGYN in, whatever city, state you live in, it should give you some options. This might be limited if you're not in the US. Even if you are in the US, there might be some states that don't really have as many options. That should get you a good start. That's a tool to help you find a doctor. If that is not enough, go to the FEMM website, FEMM. That stands for Fertility Education and Medical Management. This is where I'm doing my certification process through to become a fertility educator. So they really work with medical management or doctors to train them to recognize charting and just know how our hormones affect our symptoms. And so these doctors are trained, again, to look at your body, what the signs your body is giving. Through their website, you can find a doctor, and you can even do telehealth appointments. So even if you can't find someone in your immediate area, this might be an option for you to just talk to someone and at least get you some progress, to get a diagnosis, to get things figured out. Hopefully one of those two options can work for you. I'm so proud of you for really looking further into things, advocating for yourself, and finding a doctor who will listen, because that is so, so important. Now, when it comes to getting an endometriosis diagnosis, we first need to look at what endometriosis is. It's really tricky, and unfortunately, as with all women's health things, there's just not a whole lot of research on it. We don't really know why it's a thing. We don't know how to treat it. So our uterine lining is the endometrium. That's where endometriosis comes from. Essentially what endometriosis is when endometrium is found in places other than the uterus. It could be on the ovaries, it could be the fallopian tube. There's all kinds of places it could be. And that causes a lot of problems because uterine lining tissue, what does it do throughout your cycle in response to hormones, right? It grows, it sheds. There's all kinds of stuff that we don't want that just in random places in our body. So understanding that will help us understand how to get a diagnosis. So here's the frustrating thing. There's really only one way to get an official diagnosis, and that is to get a surgery to see if, endometrial tissue is in other places. Obviously, this is not ideal, because what if you don't even have it and you get a surgery for kind of nothing? So there are things that can be done that could indicate that you do in fact have endometriosis, so that maybe getting the surgery done is going to be worth it. So endometriosis, again, when we're thinking about what's going on there, you're going to have extra pain around your period. The problem with symptoms of endometriosis is they range so much depending on where the endometriosis is in your body. If it's on the bladder, then you might have difficulty or pain while urinating. But if it's around the reproductive areas, ovaries, fallopian tubes, during your period when uterine lining is shedding, there's going to be more pain then. And there tend to be these pressure points that could be checked. Again, you've got to find the right OBGYN who will do this. I found one who does this in Ohio, but if you're not in Ohio, look around. But it was interesting because she was able to check different pressure points. And if there was no pain in any of those areas, then I was like, okay, you probably don't have endometriosis. Because that's one of the big things about it is it's pretty painful. But obviously you have to check multiple different areas because endometriosis isn't just in one location. It could be in multiple locations. It could be on the bladder. It could, there's all kinds of places it could be. The other thing, again, kind of connected to this with trying to get a diagnosis, really be diligent in charting your cycles, especially charting any symptoms that you think might be attached to this potential endometriosis diagnosis. So if you're having certain gut issues, constipation, or diarrhea or whatever, note when that's happening, the frequency, the intensity, and the pain. Try to be charting pain on a scale of 1 to 10 and note where the pain is. If you have any pain with urination or pooping, any of that, definitely track all of that because any of that could be related to this. And even if it's not this, it could be something else. We don't want to mess around with this. We'll go through symptoms really quick, but like I said, they can range a lot. You don't have to have all of them to have endometriosis because if you don't have it on your bladder, then you're probably not going to have the symptoms of endometriosis on the bladder, right? So let's go through some. So I found a really, really interesting image here, which could be subject to copyright, but just Googling symptoms, and these are newer guidelines, and this is for, doctors. Suspect endometriosis in women, including young women under 17 years old, with one or more of these symptoms, okay? Only one or more. Chronic pelvic pain, period-related pain, deep pain during or after sex, painful bowel movements, blood in the urine, or pain passing urine. I think it's helpful then to see, this is kind of the wording and stuff that they take seriously. Now, attached to this, another question was symptoms of PCOS. There's 3 specific things that they look for. The diagnosis of PCOS can be made if just 2 out of the 3 are present. You don't need all 3 of these symptoms, but if you do have all 3, there's a high likelihood. Irregular or missed periods. This could also include very light or very heavy periods, or painful periods with cramping. But something that's typically a hallmarker of PCOS is you might have longer cycles and shorter cycles. A lot of irregularity with the length of your cycle tends to be a big one. Second one, high levels of androgens, also known as male hormones. These can cause physical signs like excess body or facial hair, acne, or oily skin. And that's something that can be tested for, to see if you have high testosterone, stuff like that. That's something that can actually be tested. Very objective thing. Number 3 is polycystic ovaries. You don't need, believe it or not, to have polycystic ovaries to get diagnosed with PCOS. So this means the ovaries are enlarged and contain many fluid-filled sacs, follicles, that surround the eggs. This is kind of important because this is typically why your period's length is irregular. You might have really, really long cycles or a lot of light periods that are actually not true periods, just kind of a withdrawal bleed, because your follicles are growing, but they're not ovulating. So they're just growing and getting big, and then so you've got just a bunch of big follicles that didn't actually ovulate. And something else just to note with PCOS, you don't have to have this issue, but if you have insulin issues, if you have diabetes, or just you know you've got kind of some insulin issues. There's a big correlation between that and PCOS. I think that at least would put you maybe at a higher risk. I'm not a doctor, so take it with a grain of salt. That's enough of question number 2. Question number 3, how your cycle affects IBS and ADHD. As we talked about with endometriosis, that could definitely affect IBS, type symptoms if you have endometrial tissue on any part of your gastrointestinal tract. So that's definitely something that you want to look into. So that can definitely be one right off the bat, that it might not even be just IBS. I know that's a label that kind of gets thrown on a lot of issues. So first look into that. Did I get a wrong diagnosis? But yeah, another thing to consider, I'm going to put a chart on the screen that is estrogen and progesterone and what they do to all the body tissues. This is really interesting and really good to know. They're kind of opposite hormones. Estrogen is like this really busy hormone that tends to build things up. Progesterone maintains things, slows things down. Now we have both of these hormones at all times, but there's times in our cycle where estrogen is the dominant hormone, progesterone is lower, and there's times where estrogen is lower and progesterone is the dominant hormone. We're gonna just do a quick overview of the hormones. So I'm gonna first talk about our cycle in terms that are going to make sense with hormone activity. So it's pre-ovulatory phase, ovulatory phase, post-ovulatory phase. Obviously, that language all kind of centralizes around ovulation. That means it's not like just day 1 till day 10 is this, day this till. It depends on your individual cycle as an individual person, and just this cycle you're in now is going to be different than your next one. Anyways, pre-ovulatory phase is day 1 of your cycle, which is day 1 of your period, up until your point of change. This is going to be some terms that you might not understand because it is based off of tracking your cycle with the FEM method. Basically, it's just a change in your cervical mucus that indicates that estrogen is rising. That's what your point of change is referring to. So, day 1 to your point of change, that's pre-ovulatory. So that's when there's not a lot going on in your ovaries, and even hormonally, what's going on hormonally is progesterone is still the dominant hormone, but just because of residual progesterone, which we're going to talk about once we get to the end of the cycle, that'll make more sense. But just know, in that first part of your cycle, which encompasses your period and maybe a couple days after, progesterone is the dominant hormone and estrogen is lower. So what you're going to experience is higher progesterone related symptoms, and you've got the period in there, so you're experiencing obviously anything around that and surrounding that. And how your period, we're going to focus on this for a minute because we're talking about how it affects things. If you have fairly painful periods, that pain, the cramping is due to prostaglandins. If you have a lot of pain, if you have really painful periods, those prostaglandins might be kind of just going crazy. They're not just kept to the small box that is your uterus. So that might be when you're experiencing period poops. All of those symptoms are happening. You're experiencing kind of residual progesterone. Progesterone is kind of relaxing muscles. It's that hormone, it's maintaining, it's relaxing. As far as ADHD, our hormones also act on our brain cells. So at this time, progesterone is maintaining and healing our brain cells. Your ADHD symptoms might actually be a little bit better during your period, which might be a little bit unexpected for you. Now, ovulatory phase begins with estrogen starting to rise, ends with ovulation. During this time, estrogen is rising and it is high. So you might have worse symptoms with both your IBS and your ADHD. So it's really important, I would say, to track your cycle, to track ovulation. You don't have to track absolutely every single little thing, but the main things that I would track is ovulation. And in order to track ovulation, you will want to be tracking cervical fluid, and LH strips might be helpful. They're also called ovulation strips. Those might be helpful also for tracking ovulation, but really the only thing that you need to track in addition to just your period would be cervical fluid, and then any symptoms. If you're noticing days that are especially worse for your IBS, your ADHD, I would be interested to note that, in your chart. If you want a chart. You can check out my website. I have like a paper chart for free. I also recommend using the FEMM app, FEMM. It's a purple app. That's totally free. Kindara with a K. That's another free app to chart your cycle. Just a shameless plug, I do teach one-on-one coaching sessions. It's just $35 for a session, like a 45-minute session online. And I can help you to chart for whatever, whatever you want to be charting. Back to what we were talking about. Charting, you don't have to chart everything. And then we were talking about ovulation. After ovulation and the ovulatory phase is the post-ovulatory phase. In that time after ovulation until your next period comes is your luteal phase. And during this time, progesterone is the dominant hormone, even more so than the beginning of your cycle during your period, because the corpus luteum is actively producing progesterone at this time. The peak is like roughly 6 to 8 days after ovulation. You might actually be feeling your best during this time with your ADHD symptoms or anything like that, because progesterone is that kind of calming hormone. It helps to promote sleep, relaxation, versus estrogen can, if it is, especially for estrogen, if it is too high, it can create more anxiety, stuff like that, trouble sleeping. So this next question is really interesting. And once again, just a reminder, I am not a doctor. I am a menstrual cycle coach. So I'm just helping you kind of figure things out. This question is, why am I getting 2 periods a month? Very good question. There's a couple different ways that this can go. So we're gonna just dive into the multiple possibilities. Now, something I asked this woman was, are you on birth control? Because that is an important aspect of it. Because if you're on birth control, then these aren't technically periods. Your bleeds when you're on hormonal birth control are withdrawal bleeds. A true period is the shedding of your uterine lining after ovulation has taken place and that luteal phase is ending. I want you to understand, what a true period is, what all of this stuff means. So that's the purpose of kind of explaining that. So the first thing is kind of diving into, okay, like, are these true periods? And that can be really hard to determine. Now, if you aren't on hormonal birth control and you are getting 2 bleeds or 2 periods a month, there's multiple ways that this could go. Like, how close is this? Is it roughly 2 weeks apart? Because here's something that could happen. You could get just your normal period, and then 2 weeks later, roughly 2 weeks later, you're ovulating, and you can bleed around ovulation, which is because at ovulation, estrogen rises so rapidly and so much, and then drops dramatically. And progesterone is still low at this time. It's starting to rise, but it's low. And so our uterine lining is a little bit unstable. So that could cause a little bit of bleeding. It shouldn't be much bleeding though. It should be very light bleeding. So if it's not light bleeding and it's at this time kind of mid-cycle, that's definitely concerning. If you are bleeding more than just needing to wear a panty liner, that day, then there might be more of a hormonal imbalance going on, but that might be something that you might have to get checked out, your progesterone and estrogen levels. That is a potential reason. There are some things that can cause irregular bleeding at different times, such as fibroids and endometriosis. Those can cause, one of the symptoms can be bleeding. If I'm remembering right, especially with fibroids, because of the nature of a fibroid, growing in the uterine lining, that's causing instability of the uterine lining, even if it's not a hormonal imbalance factor causing the instability, an actual, fibroid. If you are experiencing 2 periods a month or 2 bleeds a month, you should go to your OBGYN. You definitely want to get this checked out, because any of these issues are issues that we want to look into. You may not actually be ovulating, and these might be withdrawal bleeds, not because of birth control, but withdrawal bleeds because your body is not producing that cascade of hormones that would normally be happening if ovulation is happening every cycle. Like I explained, kind of that instability of the uterine lining, that could be happening. In this case, if you're not ovulating, estrogen isn't rising to a peak and then dropping. Progesterone is really important to maintain the uterine lining. When progesterone is high, the uterine lining won't shed. It's once that progesterone drops that your uterine lining sheds and your period starts. So if progesterone is just staying very low because you didn't ovulate and then the corpus luteum didn't form, to produce progesterone. The progesterone is going to stay low and your uterine lining is going to be more likely to, shed a little bit. If you're experiencing really long periods, more than one a month, stuff like this. Once again, for this question, you should be tracking ovulation to see what's going on, to see if you're actually even ovulating. And you should be finding a good OBGYN, like the instructions I gave earlier. Find an APRO OBGYN, look through FEM, try to find someone there, try to find someone who's going to help you get to the root of this and not just prescribe birth control, because I'm not against birth control, but I am against using it just as a band-aid when there's something deeper that needs figured out, especially if you want to have a baby in the future and these issues that are just being kind of covered up might come up and really cause more issues for you. Definitely take it as it is, which is a red flag, a warning sign. Look into it. Really be charting ovulation and charting how heavy your bleeding is, all of that to help your doctor figure out what exactly this is. Okay, on to the next question. Our next question is how to track irregular cycles. Great question, and I love that you even are wanting, to track your cycle. I love that so much, and it will help you. Again, my advice does kind of reflect on kind of similar things as past questions. Learn a method, a fertility awareness method. So the one that I teach is the FEM method, fertility education and medical management. Obviously, a big component of that is understanding the hormonal process for medical management purposes, but it also is for family planning purposes. All the possible ways to be tracking your cycle include tracking your basal body temperature, which means taking your temperature either orally every single morning as soon as you wake up, before you get out of bed, before you talk, anything. They sell thermometers at CVS for like $15 that you can use for this, or you can get a fancier one. There's also a way of doing this, something called temp drop that you wear on your arm, and it takes the temperature throughout the night, so you don't have to remember to take it in the morning. And what this is tracking is essentially, it helps to confirm ovulation because your basal body temperature, your resting temperature, rises after ovulation due to that high progesterone because it has a warming effect on the body. Another big way, like I talked about, is tracking your cervical fluid observations. This is because our cervical fluid actively is reflecting what's going on hormonally that day. So it's giving you a picture of right now. It's not an algorithm, it's not like, well, this probably will happen, this might happen. This is what's happening right now. Our cervical fluid can show us if estrogen is the dominant hormone, if progesterone is the dominant hormone. We can actually get a pretty good estimate of when we're ovulating to give us that fertile window. So that's one, cervical fluid observations. Another way is with LH test strips, like I talked about, ovulation test strips, LH test strips, it's the same thing. It's measuring that LH hormone, but it surges right before, like 24 to 36 hours before ovulation takes place. So this is another way to track ovulation. Now, LH could rise without ovulation occurring, and ovulation could occur without an LH surge. For some women, this method doesn't really help, but it's something to try. It's relatively cheap, and you don't have to take it every single day. You can start taking it on cycle day 7, or if you're tracking cervical fluid observations, start taking these tests on your point of change. Like I said, if you need help, because especially if you have confusing cycles, even if you want to just have one session for me to like clarify things or help you out with some things, especially cervical fluid, that can be a little bit confusing to figure out. You can sign up for a session, or you can even do just a free consultation call to like see if it would actually be helpful. Yeah, those are some ways to track your irregular cycles. The biggest thing is you want to know if or when you're ovulating, because an individual's luteal phase is pretty consistent. So let's say you have a 12-day luteal phase. It might vary by a day. Ovulation is the thing that is not consistent. We could ovulate anytime. So once you know, because of the other stuff, because of your cervical fluid observations, because of the LH test, and confirming ovulation with your temperature rise, because of all of those things, you can know roughly when you ovulated, and then you can count. You're like, okay, I know I have a 12-day luteal phase because I ovulated on this day this cycle. I can expect my period then. Or you can see, okay, I can tell I've not ovulated yet this cycle. Then you know, okay, I'm not expecting my period anytime soon because I know I haven't ovulated yet. And any bleeding you might experience is not a true period. 2 to 3 irregular cycles in like a 12-month period are cause for concern and definitely cause to go to your OBGYN and figure that out, because that means that you are experiencing a pattern of irregular cycles. And if it's concerning you, obviously you can get help sooner. That is kind of the answer to that question of how to track your irregular cycles. Thank you so much for watching this Q&A. Once again, if there are any questions that you have that you're like, oh, that made me think of something else, I want her to answer this question, go ahead and let me know, because if there's a lot of questions, I will for sure make another Q&A video. I would love to hear from you, and I hope that this was a helpful video. I want to hear from you guys. I want to get to know you. I want to know what is useful information for you, because I'm doing this for you. I love, love, love teaching and helping other women. So once again, thank you so much for watching. Bye.